Hi, HBC fam. It's Dr. T hopping on here for what? A quick minute. That's right. Today we have a very important topic to discuss. But before we do so, I have a quick question for you. What is the most common virus to cause birth defects? What do you think? If you're not sure, definitely stick around. We're going to talk about it. That's right, you guys. So today we are celebrating or bringing awareness to a very important topic. We're going to talk about the number one virus to cause birth defects. Well, if you have guessed, you probably have guessed some of the more commonly known viruses, such as herpes, HIV, maybe even human papillomavirus. And some of you guys may be familiar with even parvovirus, which is a common childhood infection. But today we're going to talk about the number one virus to cause birth defects. Today we're going to talk about another important virus called cytomegalovirus. That's right, cytomegalovirus is the number one cause of birth defects as a virus. Pretty interesting, huh? Let's talk about it. So for most individuals who have been infected with CMV, which is cytomegalovirus for short, most people do not actually have symptoms and are considered to be asymptomatic. But if they do have symptoms, they're more likely to have fever, sore throat, fatigue, swollen glands, and even muscle aches. This is a virus that can infect all ages. It's a very common childhood infection. In fact, nearly 1 in 3 children are already infected by the time they are 5 years old. And for adults, by the time we hit 40, about half of adults have actually had the virus as well. But for most individuals, there will be no symptoms, as I mentioned. However, this is one of those viruses that can actually reactivate in person's body. And so you may have a viral infection now, but later on in life may have a reactivation of the CMV virus. And there are different strains of CMV. So you may have an infection with one particular strain of CMV, and then later on in life may have infection with another strain of CMV. Pretty interesting. Sound familiar? That's right. Very familiar, right? Similar to the herpes virus. And that is because CMV is one of the viruses that belong to the herpes virus family. So typically when we think about the herpes virus family, we think only of herpes simplex 1 and herpes simplex 2. But there are a number of other viruses that also are members of this same viral family. And that includes another very commonly known virus called varicella zoster virus. VZV or varicella is the virus that is responsible for the common infections of chickenpox and shingles. And as mentioned, CMV is also another one of the viruses of this particular family of viruses. And so is another very commonly known virus called Epstein-Barr virus, also known as EBV, the virus that causes the very classic mononucleosis. But guess what, you guys? CMV can also cause mononucleosis as well as hepatitis in some rare cases. But today we're going to talk about CMV in regards to pregnancy. So what are the things that a mom should know, right? Let's talk about it. So we're going to put special attention on talking about CMV in regards to pregnancy. And that is because June is CMV Awareness Month. And why is that so important for us to talk about? Because about 1 out of every 200 infants are actually born with congenital CMV. And as I mentioned, CMV is linked with birth defects. Around 1 in 5 babies born with congenital CMV infections will actually have long-term health problems. That's pretty important, pretty crucial, right? So here are the things that you should know. A pregnant woman can pass on CMV to her unborn child. And a matter of fact, a pregnant woman can pass on a primary infection, meaning this is the very first time she's infected with CMV, and she can then transmit the virus to her unborn child. Or she can be reinfected with a different strain of CMV. So she may have had CMV years ago, but then get infected with a totally different strain in her current pregnancy. And the third way is, as mentioned, she may have been infected years before or months before with CMV, but have a reactivation of the same strain of the virus. It's important for pregnant women to know about this particular virus because it is highly transmittable from mom to baby in utero. However, even more importantly, it's more likely to be vertically transmitted from mom to baby during the pregnancy in the third trimester as compared with the first and the second trimesters. Also important to note is that you're less likely to transmit the virus to the unborn child if it's a non-primary infection compared to primary infection. And again, primary infection means this is the very first time that mom is infected with the virus. So when babies are born with congenital CMV infections, they present with a classic group of symptoms, which includes jaundice, microcephaly, which is a small head, an enlargement of the liver or spleen, seizures, retinitis, which is the inflammation of the retina, a low birth weight, a rash, or even most importantly, intrauterine growth restriction, which is when a baby is growing so small and so slowly that we're highly concerned that the baby may not survive in utero. For babies who have more long-term health effects, they may experience things such as hearing loss, intellectual disabilities, significant weakness, a small head, as I mentioned before, seizures, and vision loss. Pretty crucial, right? These are really important symptoms to be aware of. And that's why it's so important to know how to prevent acquiring CMV during pregnancy and also how to minimize your exposure. So let's talk about those.